have a family, you make $50,000 a year, you can't feed your family.
Right.
Middle class, taxes have gone up. Medical costs, as a direct result of the Affordable Care Act, went up.
Well, that I don't agree with.
Private insurance went up. My
Private
insurance went
insurance
up
is going
as a
up
result.
anyway. I don't agree as a result of the Affordable Care Act.
But the
Okay.
insurance company sends you a letter that because of the new American Care Act,
Of course, the insurance company is going to
blame.
blame it on the Affordable Care Act rather than on itself.
Obama cut Social Security by 2%
What?
3 years ago.
Say again?
Obama cut the Social Security withholding 2%.
Yes.
And they went back into effect.
Yes.
So we all, technically speaking, we all had a tax increase.
Yes.
Not federal tax, but some kind of
FICA
tax.
tax, yeah.
So sometimes I speak to my friends and they say it doesn't even pay to work, because if you don't work, you take Section 8 food stamps and all the benefits, and you get more money than if somebody works and gets paid $56,000 a year, and they pay taxes and they end up with less money. How do you help those people?
Some of these programs need to be on a sliding scale.
Some of these programs.
It doesn't accommodate this community because...
Well, I understand the question. I agree with you. And there are a number of things which number one, let's take the Social Security tax thing for the moment. I didn't like the fact that we cut the Social Security tax. Initially, in the stimulus bill back in 2009, we established a make-work-pay tax credit, which was much more progressive, which was designed to help people up to about, I think, $50,000, $60,000. And it was a straight tax credit of roughly, I think it was $800 per person, twice that per family, whatever, I don't remember. That was done for a year or 2 years under the Stimulus Act. When that came up for renewal, the Republicans opposed renewing it. They don't like tax credits for low-income people. They like tax credits for high-income people. And they were very much opposed to it. The compromise was that we would cut the FICA tax by 2% for a year. We extended it another year. Now that was a problem. It delivered about the same amount of tax relief as the make-work-pay credit had delivered. But it took money away from the Social Security Trust Fund, $120 billion a year. We replaced that from the general fund. As part of the same legislation, we said the general fund will give to the Social Security Trust Fund the difference, $120 billion a year, as long as we do this. The problem with that is that when anybody comes along and says Social Security should be cut as part of the deficit, our argument always was, and is, Social Security doesn't contribute to the deficit. There's nothing to do with it. It's walled off. Which, if you're taking $120 billion from the general fund and giving to Social Security, is no longer true. So it was enabling people who were hostile to Social Security to bring Social Security back into the deficit debate. So we wanted to stop that and replace the tax relief with something that didn't come out of Social Security. There's no particular reason it should come out of Social Security, which is convenient. Unfortunately, we took it away, but we didn't replace it at all. I disagreed with that, but because I think that my general view is that corporate income tax, which used to provide, when I say used to, I mean 35 years ago, 30% of federal income taxes now provide about 5% of federal income taxes. We've greatly lowered the effective tax on large corporations. We have to restore it. And we've greatly increased the effective tax on middle income people. We have to reduce it. That's my general view. Aid programs like Section 8 and others. There are. Well, I'll tell you a little story. I had a dispute with my predecessor many years ago when I was in the State Assembly. And Section 8, this annual appropriation, came up for renewal in Congress. Section 8 is the housing subsidy. And some Republican, this is 1978, so I have no idea who it was, but some Republican got up. And now Section 8 is a subsidy. It pays the difference between whatever the rent is and 30% of your income. So obviously for really poor people, it's a very large amount of money, comparatively. So, and the income limit is fairly low. So some Republican got up in 1978 and moved an amendment to the Section 8 bill and said we should take 15% of the Section 8 money And instead of having a deep subsidy for low-income people, we should use that money for a shallow subsidy for moderate-income people, people who are higher than the low-income people. And my predecessor opposed it. He led the opposition, or one of the leaders of the opposition, and he said this was anti-poor people. And I called him up and I said, Ted, you're making a terrible mistake. For two reasons. Number one, the moral claim of a person making $40,000 a year, let's say, who cannot get decent housing on the open market, the moral claim to government help is just as great as the person making $10,000 a year who cannot get decent housing on the open market. They both have a moral claim to help. He needs less help, but he still needs help. Number one. Number two, if you're going to say that Section 8 is only going to be for really low-income people, you're going to lose the middle-class constituency to maintain the political support to continue it. And to a large extent, politics in this country is a battle between the liberals, whose job it is to convince the middle class that their proper alliance is with low-income people to maintain government support for these programs, against rich people who don't want to pay taxes for them, versus the conservatives, whose job it is to convince middle-income people that their interest is to ally with the rich people so that the taxes are lower, and to heck with the help for the lower-income people. And to the extent that you remove any middle-class help from whatever the government is doing, whether it's tuition help in college or whatever, you are playing on the wrong side of that argument. And that's why I have always opposed means testing programs. So when some people, what? I disagree with Obama on another thing. So when some people, well, I'm very much opposed to that. And when some people say we ought to means test Medicare, God forbid, or certain other things. And I'll give you an example. Everybody knows, obviously, that if you're earning $65,000 or $70,000 a year, you can afford to send your kid to college for $45,000 a year without any help, right? It's ridiculous. And yet, if you look at government programs for Pell Grant aid or whatever, it's means tested and it zeroes out at low numbers. So these programs help low-income people and maybe even low middle-income people, but they don't really help middle-class people. And I think that's wrong. I think it's wrong because middle-class people need the help, and they have just as moral a claim to the help as anybody else. And number two, it's politically dumb.
So what can be done? I mean,
well, it's a
the fact
continued.
is both parties always, like I say, screw the middle class.
Well, you've got a basic difference in approach. And I'm not going to be a down-the-line defender of the Democratic Party. I don't. The Democratic Party's economics are too conservative for many states, in many ways, and much more conservative than it used to be, by the way. Much more conservative. If you ever want to have an interesting time, go to the library, get out some film clips of the rhetoric of people like John Kennedy or Adlai Stevenson or Hubert Humphrey or Stuart Symington from the 1950s and 60s, and you wouldn't believe how left-wing that rhetoric sounds compared to today. It's just amazing. The party's gotten much more conservative economically than it was. And it's done gradually so you don't realize it, but it's much more conservative than it was, say, 35, 40 years ago.
Even Obama?
Yes, definitely Obama. Obama in 1950 probably would have been an Eisenhower Republican. If you look at the, I'll give you an example. If someone had come here from communist China before they opened up, someone who never read a newspaper, didn't know anything about the United States, and he come here 20 years ago, and it said, what's the Republican and Democratic position on health care? He probably would have been told, well, the Democratic position is we should expand Medicare to cover everybody, some sort of government program. And the Republicans are more free market oriented, so they'd probably say, well, you ought to have the insurance companies do it, and people can't afford the insurance companies, subsidize the premiums for the insurance companies, which is, of course, exactly what we did. That's Obamacare. But this was what 20 years ago would have been regarded as a Republican, and in fact was a Republican proposal.
Well, let me be clear, we're not calling the president a Republican.
No, I'm not calling the president. I'm saying
he's a clear Democrat.
I'm saying that parties shift over time. The Democratic Party is a more conservative party in economics than it was 30 or 40 years ago, and it's objectively truthful.